Okay, and we are now officially live. I think we can give people a moment to join, as there was some confusions about timings as we were having some technical issues as well. Thank you to anyone who stuck around, and hopefully everyone saw our message about having to postpone for a couple of minutes. But we're very excited about today's live stream and getting to introduce you to Geoffrey, who's very recently joined our team at Wave here. So we'll be getting to explore a little bit more what we're hoping to do in the future with him, and a little bit of his previous experience as well before joining the team. I know that we've got some ambassadors as well who are hoping to check in when they can, but either driving or during their workday, etc. So they might not be as active in their usual messages throughout, but I'm sure they'll be checking it out in the catch up as well. How are you feeling about this, Geoffrey? I know that you've done many an interview before in your experience on this. I think we were discussing it with some of our new patron as well around media appearances, etc. So I'd be surprised if this wasn't quite a familiar routine for you.
No, I've done a lot in the past. I mean, when I was at the British Red Cross and the international director of the British Red Cross, I was traveling all around the world. And every time I came back from wherever it was, Afghanistan, Somalia, whatever, I'd be raced into studios to do BBC live television and radio and so on. So, no, I've done a lot of it.
Wonderful, wonderful. Glad to have someone experienced with me. Got a first couple of people joining there, so please do say hi as you come along. Let me do my usual comment to let people know they can say hello. Always good to be able to see who's with us, but we can go from there, and I'll get us started with the first question in a moment or so, Geoffrey.
Okay, fine. Ready when you are.
Here we've got Donna joining us as well. Hi, Donna. We've got a couple more people who seem to be watching but haven't said hello yet. So getting a few people. This is the first time we're trying a live stream during the day rather than more in the evening. So it'll be good to see how it does with everything else. We've got Bin joining us as well. Hi. Got a few people coming in there. Well, as we've got a few people then, I won't keep them waiting. So for a little bit of context, Geoffrey, you've now joined us as the new CEO for our charity Wave Trust. I know that a lot of the previous live streams that we've done have been connected with our 70/30 campaign, which is just a small part of all of the charity's great work. You've been with our team really since June, in an official capacity, though I know that you were having conversations with us before that as well. And I guess I wanted to kick off today's conversation by asking you, what drew you to Wave as a charity?
Well, I mean, first of all, I'd spent a lot of my career working for and supporting vulnerable people, particularly young people, helping with health, mental health issues, and people after emergencies. My first job for a charity was as international director of the British Red Cross, and then I joined the International Federation of the Red Cross, and I traveled around the world. So I worked in disaster situations in Somalia, Rwanda, former Yugoslavia, Afghanistan, which sadly is still in a difficult position now, Syria. I spent a long time in Indonesia and Sri Lanka after the tsunami, and for a year of my life I was actually head of the International Red Cross in North Korea. One of the examples in Afghanistan was that there was a mental hospital right on the border in Kabul in the city, but right on the border of where the fighting was. And we greatly assisted those people and moved them to a safer place, and then obviously had staff to look after them. But I care very much about vulnerable people in the UK, particularly young people suffering from potential trauma issues. Before I started work with Wave, I didn't know a lot of things which Wave are involved in, and I did a lot of research beforehand. I didn't know, and I think a lot of people don't know, that a child's brain grows particularly in the first 0 to 3 years of their life. There are some very serious issues in the UK, and a growing level, sadly, of child abuse in the last 50 years. And COVID has highlighted some of those issues or made them even worse. Our aim, 70/30, our aim is to reduce child maltreatment by 70% at least by 2030. And it is a really serious problem. Just to give you an example, and we've done quite a lot of research on this, non-secure children, so children that have come from families that have caused them problems, there's been abuse, etc., etc. Secure versus non-secure children, so a child that goes through this and is therefore not secure. Children with disordered attachments or insecurity are 2.5 times more likely to have criminal convictions by the age of 21. They're 75% more likely to fail at school and 70% more likely to be drug addicts. It is a serious problem. And I have to say, in all the conversations I've had since I joined, and I'm talking to large numbers of organizations, government organizations, local government organizations, potential funders like corporates and trusts and foundations. The vast majority of those people do not understand the seriousness of this issue and how large it is in every country, but in the UK in our case.
Absolutely. Thank you, Geoffrey. And I think you've given quite an important overview there of why WAVE is focusing on all these issues and quite how significant they are and why it's so important to be doing good work to tackle them. I've got a couple more questions, but I will say a quick hello to some of the other people who've joined us as well. I think Jay's been able to pop in, so's Lynn, and Claire's there supporting us as well. So hi, everyone. Claire's actually been nominated as one of the best ambassadors for the year this year on our last ambassador call, so it's wonderful to see her joining as well, sharing some of the after effects as well of trauma can be debilitating. So it's good to see passionate people joining in on our conversation today. Please do drop any questions you have as well, and I'm sure we'll find some time to put them to Geoffrey as well. Seeing Angela's joined as well, so we've got quite a good group coming in there. And so, yeah, I think that actually leads me to my next question, Geoffrey, which is a bit more of a spontaneous one, I think, than the ones we've discussed previously. But how have you found working with the team so far? How have you found working with the ambassadors, working with the staff and everyone? What's it been like?
I think the bottom line of all that is how dedicated everybody is. The staff, and it's a relatively small number of staff, are working their socks off at the moment. We all put in an enormous number of hours. Because we really care about what we're doing. And as I said earlier, it's a much bigger problem than most people, the vast majority of people would realize. So once you get involved in it, you really feel dedicated towards it. I think the ambassadors are doing a fantastic job. And a number of them, Claire, Jay, for example, have spend an enormous amount of their time talking to local authorities, talking to local communities and things in the areas that they work in. And we want more and more ambassadors to develop that. There are some fantastic ambassadors. Generally speaking, I'm really enthusiastic. WAVE is an amazing charity. And the people I'm talking to that didn't know about WAVE beforehand, when I speak to them, they A, didn't realize the scale of the problem, and B, they're very, very impressed with what WAVE is doing. And we need to expand. We've got to work to get more people, more ambassadors, slightly more staff as well, definitely, because it is an enormous problem.
Absolutely. And the more of us there are, the easier it is to tackle such a huge issue. And I think I'm just going to flag the website up here for anyone who is interested in getting involved. You can find everything that we're doing there, how to get in touch, how to become an ambassador if you are interested. But I think the more of us who are passionate about this issue who are working together, the better. That's how we really create this impact. And I think from my side, what I was really glad to see when I started working for WAVE was that it's not just that we are overwhelmed by such a large and complex issue, is that there are solutions and there are things that we can do about them. And we know the roadmap to that. We know, and it might not be something that changes in 1 year, but long term, you can really start to break into generational cycles. You can really get at the root causes of what is happening. And I think I'd love to hear from you. Why do you think that prevention is so important? Because that is absolutely at the heart of all of WAVE's work.
Well, the kind of three things we do, I mean, one of them is working locally with local authorities, with social services, healthcare, and so on prevention issues. And the second one is to talk to government, and I've done a lot of that recently, the House of Lords and the House of Commons, despite all the issues they're going through at the moment politically. I've spoken to them about, trying to change some of the policies and improve some of the policies so that we can address this issue. As I said earlier, I hadn't realized that children from the age of 0 to 3, their brains are growing. And if they go through a very bad or a very sensitive background in their families or the people that are looking after them and so on, they're affected for life. It's a real serious series of traumas. So, as I said earlier, one of the things, prevention is extremely important. The other area, the third area that we work on, is if people have got a series of traumas, and we're doing work, for example, in prisons, we're doing work in schools and so on, to train people to get their situation better. And you can do quite a lot. It's a very important thing to do, but it is obviously better if you can get involved at the beginning and prevent these issues.
Yeah, I think I've been quite lucky in my work in WAVE and being able to have quite a lot of insight on both sides of, I think, that the kind of primary prevention and being able to support people afterwards. I think I was really struck by, as you said, a lot of the impact that can be had in those early years in life. Kind of conception to age 3, the first 1,001 days, however you kind of want to focus in on it. But not only is it a time when adversity can have a huge impact, it's also a time in which you can create a huge buffer for any adversities that might happen later in life. If you give families, if you give the child the right kind of structure around it, the right kind of support, the right kind of love. And it is really a case of making sure that a child's brain is built to expect compassion, is built to expect empathy, is built to expect predictability and safety. And that can have a huge, it lays the foundation for them to expect that they can cope with whatever life throws at them in a really meaningful way. And I know that we are doing a lot of work currently to bring one of the many different interventions WAVE's kind of researched and approved of that can help in these years, called parent-child psychological support, from Spain, to really start supporting those early years, supporting that early attachment bond being created. So I think it's a great example of one of the things that can be done to move things forward in that direction. I'm seeing Claire down here saying knowledge is power as well.
Yeah. The other thing, I've been talking to government representatives and House of Lords representatives about, particularly with the situation in politics in the UK at the moment, is that yes, it's a long-term problem that we're resolving, but there are actually benefits in the short term. You can measure that if you are getting involved with prevention, there are, even in the next few years, there will be significant improvements to the community in doing that. If you leave it and you don't, I remember at the beginning when I first got involved, I described it as, stop people, instead of people falling off a cliff and then helping them when they've fallen off the cliff, build some fences to stop them falling off the cliff. It's a combination of both, and it's really important. But there are short-term benefits, and some of the government officials that I've been talking to recently are very interested in that, because obviously in the UK, there'll be a general election in a couple of years' time, if not sooner than that. So we need to show that we're actually moving things forward, even in the short term. And I know it's not the core issue in this, because the core issue is to help these people. But the cost savings involved, if you get involved and stop more and more people going into trauma, more and more children getting into trauma situations, the cost savings in the UK economy and any other economy are really, really big. They're really significant, because the cost of otherwise children getting involved in drugs, going to prison situations and criminal activities and so on, costs an enormous amount of money. Now, obviously, with the current situation in the UK and the economy in the UK, which is slightly going down at the moment and hopefully will improve, but that's a very significant issue as well. So not only are we doing a fantastic job in helping people, young children, and generations to come, but also there are significant cost savings in this.
Yeah, you've kind of triggered two thoughts for me there. First of all, I think in cost saving things, we often say that, but don't spend the time to really conceptualize the extent to which all of these things are costing society. If you think of school exclusions and all the extra money that has to go in to support there. If you think of drug and alcohol problems and all of that follow-up support that is needed, both in terms of maybe police, but also, you know, mental health support, drug and alcohol support, etc. If you look at all of the health costs of higher rates of cancer, of higher rates of lung disease, etc., etc. If you look at higher rates of struggling with work, with struggling with housing, etc., and all of those issues are really rooted very often in childhood adversity. That's not to say it's the only factor within those, but it's certainly one of the key ones. And if we were able to prevent it before it happened, you know, the change to the economy is really, I don't think it can be overestimated in a sense. I think the other thing that you mentioned.
I'll give you just one example. Let me just give you one example, obviously without mentioning names and so on. But there's a 14-year-old boy, and he is being looked after by, the mother actually adopted a young girl years ago, and the young girl then had problems and disappeared out of the country at the age of 16. And the son that she had was about 3 or 4 years old. He's now 14. He doesn't go to school. He's had really serious trauma issues. I won't go into the details of that, but there were serious issues when he was with his proper mother and the father at the time. And he's really struggling. And, you know, he won't get up in the morning to go to school. This is affecting his life. And it's something that could have been avoided.
No, 100%. And I think the other thing that your previous answer triggered for me was really the impact that we can have on politics in different ways. I think that a lot of the time when we're looking at a problem this big, it's easy to feel helpless. I think it's really important to say, you know, you contacting your local politicians, you getting involved, voting when it counts, talking to people in your local community to make sure this is an issue that is on people's minds, that is on the agenda, is something that really does push change in such a significant way. And it is a really, you know, it's small actions that have a very big impact in a certain way. So even if this isn't your area of expertise, I think, you know, talk to people about it, let them know that this is what we care about. And even if, as you said, not everyone is willing to take the longer term perspective immediately in politics, there are still short-term benefits, and they will care about what their community cares about. I'm seeing some great messages in the comments that are distracting me just a little bit. I think we've got some great messages here for the ambassadors for you, Geoffrey. We've got Jay saying he's already met you and was wonderful. Pleased to see quite how passionate you were and are about everything we do. And Claire as well, that is very, very glad you've joined the team. So glad to see everyone there. Here's a wonderful message. I would need to double check this figure, but I wouldn't be surprised based on what we know of ACE's annual cost being around 48.2 billion. I don't know if that's the exact number without double checking my numbers, but I definitely know it's in the billions and would not be surprised. So thank you there for sharing.
I've used figures of over 35 billion, and you're right. I mean, the figure that's just been estimated there is right. It is a really serious problem, both from a point of view of helping young people and helping the community, and the cost to the community as well. And I think what WAVE is doing is absolutely fantastic. And the ambassadors, the dedication a lot of the ambassadors have, and spending a lot of their spare time talking to the community, talking to local authorities, talking to social services and so on. There's an enormous amount to be done.
100% agree. I think before I go into kind of the future of WAVE and the future of you, the CEO of WAVE, I know that you hinted at the beginning some really interesting previous experience that you've had, and I know the two of us has talked about it before, but I'm sure many people who haven't had the pleasure of meeting you yet will be very, very curious to find out more about your past in the charity sector. So I was wondering if you could give us a kind of a brief overview of your career before joining WAVE, because I know you've been able to stack up some truly impressive experience that I think you're going to be able to bring into WAVE in a really interesting way going forwards.
Yeah, I had a degree and a master's degree in development economics, and I started work as a consultant, and I was working on a World Bank project in Bangladesh, and I hadn't been to Bangladesh before in those days. And I saw people, whole families sleeping on railway tracks because they lived in shanty towns, and the shanty towns were flooded for over a month, nearly 2 months every year. So there were whole families that were sleeping on railway tracks when the last train came in at night, and it was horrendous. One family I got to know quite well. I went to see them coming back from the World Bank office every evening. And on the last evening I was there, they made me a cake. And I was so embarrassed. I raced back to my hotel and bought all the cakes I could, went back to them and some of the other families there. And I came back to the UK and I said, I'm going to work for a charity. That's what I want to do. So I became very quickly became international director of the British Red Cross. And after about 3 or 4 years of doing that job, where I worked all around the world in disaster zones and emergency situations and so on, largely concentrating on medical help, psychological help, health in general in most of those countries. I then, after about 3 or 4 years, said to the head of the International Red Cross, I'd like to be a country director for the International Red Cross. And they said, got just the job for you. You'll be living in Pyongyang because you're going to North Korea. So I spent a year of my life in North Korea running the whole of the operation there. And then got promoted to be the regional director for the whole of South Asia, which was 8 countries. So I basically was running India, Pakistan, Afghanistan, Bangladesh, Sri Lanka, etc., 8 countries in total. The other things I've done, I had a contract for 2 years. I extended by a year. And then I came back to the UK and I became chief executive of Care International. And I did that job for 10 years and significantly increased the work of Care. And the other thing I did was to get charities to work more closely together. So when you had a disaster situation, I would say to Oxfam, you look after the water supply for these people. Care, we're going to look after food. Somebody else, Red Cross, we're going to do so and so. And I think that's really important that we work closely in partnership with organizations. The other things I've done after that, I became chief executive of the Royal National Children's Foundation, which basically looked after vulnerable children in the UK. And I did that for 2 or 3 years, which I really loved. And I thought it was very effective. I then also became volunteer chair of an organization called the Rocking Horse Appeal, which supports children's health and mental health issues and organizations, including children's hospitals in the whole of Sussex and part of Surrey as well. So I was a volunteer chair there for 5 years. And so I'd be working full time in London and then catch a train to come back and have a board meeting they were based in Brighton and so on. And the other thing I did was I volunteered for an organisation called The Passage, who are based near Victoria Station in London. And they basically look after vulnerable people and people that are living on the streets. And last example, when I was in India, I did a lot of work with railway children, who are basically children that sleep on platforms in railway situations. And understandably, a number of them get abused as a result of that. And that's something that I absolutely detest. I also worked with the previous Foreign Secretary when I was with Care International on gender-based violence issues in a number of countries in Africa. He was trying very hard, William Hague it was, and he was trying very hard to get the politics in these countries changed so people recognized that gender-based violence was appalling. I said that I fully support what he was doing, but I said, we're actually, as Care International, going to set up small clinics and community centres so that people that have been abused, quite often who don't want to talk about it, have something where have an organisation they can come to and get health care and get medical assistance. And that was extremely effective in about 9 or 10 African countries where I worked in. And finally, most of the times when I came back from working overseas, as I said earlier, I'd be interviewed by BBC or whatever on the television and the radio. And quite often people, the 6th or 7th question would be, you're doing a fantastic job overseas, but don't you care about the UK? And I said, yes, I do. And I really do care. And as I said earlier, only really when I started investigating just before I joined Wave and what we did was when I recognized how serious these issues are, much more serious than I had originally imagined in the UK. So that's my brief background. And I think CARE is a fantastic organisation and I'm really pleased I joined.
Absolutely. I think you've done so many wonderful things already, and I'm excited to see what we'll be able to do together moving forwards. And I think the last thing you said there around don't you care about what's going on in the UK is really interesting for me. So for those of you who don't know, WAVE actually stands for Worldwide Alternatives to Violence. That is kind of the origin of the charity. And whilst we're very much starting from the UK is where it's based, because you need a model that you can build outward, and because as Geoffrey's pointed out, there is a lot to be done here already. That's not to say that we don't take an international perspective, and that international perspective can often come in the research that we build our work on the evidence base that we build our work on. It can be true as well in the partnerships that we build. We've done a lot, for example, with the World Health Organization. Some of the work we've done has been endorsed by UNICEF. We've given talks in Norway, for example. Whilst the UK is definitely where we are starting and where we are building from the ground up, we're not in this fight alone, and there is a lot of work around trauma, around ACEs happening in the international world that I think will have an effect on us, and that we will have an effect on, that will be very interesting to see in the future.
Yeah, I think just to add to that, you're absolutely right. There are lots of things that we're working on where we can give experience to other organizations and other countries, and likewise the other way around. There are countries that are working very hard on this. You mentioned Norway, for example. They are working very hard on the same issues. So again, it's a partnership. Let's talk to those organizations. We will advise them, they will advise us, and we can drive this whole situation forward. It is a worldwide problem.
Absolutely. I think whilst you were talking, you were giving many, many great examples of your leadership and what you've done previously. And I thought it might be useful, as I know that we have quite a lot of ambassadors listening in today. Do you have any tips for someone who's wanting to become a leader in their community, in whatever, to whatever scale? But do you have any tips as to what makes a good leader?
I think, first of all, it's passion. I think that's one thing that, everybody that I've met in WAVE since I joined them, all the staff, all the ambassadors, and I want to meet more and more of them and actually travel a little bit around the country and see more of them and spend some time with them. But passion it comes across. If you're doing an interview or you're talking to local authorities or you're talking to just general communities and things, and you come across like this, people go, wow, this is obviously something. The other thing, my father was very good at this, and I think it's one of the strengths that I've got, is to recognize that you're not brilliant at everything in life. You can do some things and you're very good at those, but you need other people to work with. And it's therefore working as a team, which is really important. When I was with Care International, a very junior member of staff came up with an idea as to some different things that we did. It was actually very successful. And it was something that the senior management team hadn't thought of before. And it's now still a part of the work that Care does. So I think the teamwork is really important. And as I said just now, recognize that you're not brilliant at everything. You are very good at some things, and you need to bring in other people and work in partnership and as teams to really develop it.
Mm-hmm. No, I fully agree. I think that's being echoed in the comments as well. We've got Claire saying passion, dedication, and empathy. And I think empathy is a key one as well with everything we do in WAVE. Certainly, if we're going to be trauma-informed leaders. And as you say, teamwork makes the dream work is always a good little reminder of how important it is to build on everyone's strengths to get as far as we possibly can. Yeah. So let me have a look here at my questions again. I will say to anyone who's listening, please do feel free to stick any questions you have for Geoffrey in the comments, and I'll highlight them as we go along as well. I know we've had some great supportive comments so far. But
I think one of the issues actually, Isabel, which would be quite good is, what are my hopes for the future of WAVE?
That was going to be my next question. So you've guessed the direction I was headed in. Please let me know what are your hopes for the future?
Well, first of all, we're a relatively small charity. So, the underlying word is expand. We really need to. We're being called upon by a number of organizations. We recently put in a massive bid for one project, which is a 3-year program. And we're really strong. We've got some fantastic background and some fantastic people, ambassadors and staff, to develop this program. But we need to expand, and it is as I said earlier, a very serious problem. And at the moment, it's growing. It's a growing problem in all countries. And I did mention it before, but COVID hasn't helped. I mean, a lot of children that and families have struggled, understandably, we all have, because of COVID, and people being locked up at home, and that has accentuated some of the problems that we recognise. We are behind some other countries. We mentioned that earlier, and I think that that's something that we want to develop, and we are developing, talking to countries like Norway, which is, they're really working on some of these issues, and in some ways, policy-wise, they're more advanced than the British government is at the moment. So that's something. Prevention, change the policies. Prevention is really important, and then the training bit. I mean, I've sat in and listened to some of the presentations of the training work that you, Isabella, has done, that other members of staff have done, and it has a significant effect on the lives of the people that have had traumas, a significant effect. It's far better if you can prevent it in the first place, but the training bit is really important, and we can have a significant effect on people. Children and adults with trauma issues can have a really positive effect on that person's life. And the other thing is that it goes from generation to generation. A lot of children that have been through these problems and then get involved in criminal activities, drug-related problems, don't bother to go to school anymore from the age of 12 or whatever. A lot of those are then passed on to the next generation. And that's something that we can prevent. And then I think the other thing, which we've mentioned before, is changing government and local government's policies. Generally speaking, I've spent a lot of time recently, as I said, up in the House of Lords and the House of Commons talking to people, and they understand the issues, but they need to have it explained what they, as an MP, can actually do to start developing these. And as I said earlier, there are short-term benefits as well in this. So even if you're an MP and you think, well, in 2 years' time, there's going to be a general election, maybe I won't be an MP anymore. They need to know that they can actually make short-term improvements as well, and that those can be proved to people and help them.
Absolutely. And I think, some of the short-term impacts that we see, even if you just think of a round of trauma-informed training in one small organisation, that changes things day in and day out for people who come in the little ways. I think we've all had experience of a bad doctor's appointment, or a grumpy receptionist at the bank, or uncomfortable meeting with the police or something similar, where you've just left the situation not feeling safe, not wanting to repeat it, not understanding it, and just something as simple as some of the trauma training can already have a huge ripple effect in different ways there. If you then look at the bigger changes that Wave is working to do, I think we really shouldn't underestimate what can be done in 2 years with the right support.
Absolutely. Let me give you an example. One project I was working in shanty towns down in South Africa, and I met somebody and we started chatting for a few minutes to them, and they worked for a charity looking after starfish, believe it or not. We walked down the beach with this person for a few minutes, and there were some starfish that had been brought in by the tide and were on the beach. And this person went up and collected some starfish and put them back in the sea. And, afterwards I said, but this is a massive problem. I mean, how are you going to cope with this? Because a lot of these, in that case, starfish die. And this person said to me, well, I've just saved the lives of 10. And that's a fantastic example of what we can do. It's an enormous problem. We're working very, very strongly in the right direction to ultimately solve that problem. The 70-30 campaign, for example, would be fantastic if we can achieve that. We're working really hard to try and achieve it. But even in the short term, to help one person from one family is an amazing thing to do. And then we need to develop that.
Absolutely, and fully worthwhile. Now we've got some questions come through as well, so I might switch to them for a moment. The first question from Lynn. First of all, she was saying, I love your passion and your background. So thank you, Lynn, for sharing there. But she wants to know, how can we learn more about how to expand? I think this is in reference to us being such a small charity with such a big impact already.
Yeah. Well, two things. One of them is, as ambassadors, talk to the local community and get more people involved, and get them to, once they understand the issues. And I'm speaking a lot to corporates trying to get fundraising at the moment, funding from them. And a lot of the people, as I said, don't understand the issues. So talk to these people and start getting them involved in it. That's fantastic. The other thing is, on the work that I'm doing with trusts and foundations and corporates. Um, you know, I um, I think probably some people might say that I'm a bit pushy, but in talking to some of the corporates that I know, and in previous jobs, I've had significant sums of money, millions in some cases, from organisations like Barclays, Lloyds Bank, and so on and so on, but a whole series of organisations. Um, Talk to those people and get them involved and get them to come back to you and say, actually, I'd like to help. What's a sensible thing to do? The last application I sent in to one particular corporate was yesterday, and what I'm trying to do with them, and I'm trying it with some others as well, is to get some funding to come in to support us with bringing in another member of staff, a senior kind of trauma expert and so on, to add to the team we've got. So I think the short answer is, show you are all passionate. I know that. So show your passion. Don't be frightened to talk to people. Sometimes, say to them, can you help us in some way? And then start developing that, either by spreading the message across more or by getting in fundraising for it. Let me give you one example. In one of my previous charities, I used to commute up to London from Sussex, where I live. And I managed to get National Rail to put free posters on the inside of the trains, and they did the whole thing free for us. So we just had to print them off, and it actually explained the charity and what we were doing. As I was getting off one day, I live in Haywards Heath, so as I was getting off at Haywards Heath, this slightly older couple were looking at one of the posters and talking to each other, so husband and wife, and they were saying, "This sounds an interesting organisation. I wonder what they do." I said to them, "Excuse me, I'm actually CEO of that organisation. If you've got a few minutes, I could buy you a coffee, which I paid for myself, on the station platform and talk to you about it." Yeah, okay. Within about 3 months, they had left the legacy of their house to the charity. And I secretly went to have a look at the house. It was worth about £800,000. I mean, that's the kind of thing that we can all do. When you're passionate, and you are all passionate, talk to people and slowly get that message across, and it will be extremely effective.
Absolutely. And I think we can sometimes be a bit hesitant to ask for things, but we won't get change unless we have that kind of courage to ask. And that is one of the great things I think about, for example, the 70/30 network, is that we get that support of lots of other people who are passionate in the same way to kind of bolster us up and give us some of that strength that is needed to go out and really ask for the change that we want to see, ask for it in the community, ask for it at a political level, ask for it in kind of a smaller individual size. But there's definitely a lot that can be done, and a lot of people who are starting to do great work there.
Yeah, I think the one other thing I would add to that, and this is in my experience is very effective, is in your own mind, and preferably on a piece of paper, actually write down what the charity does, but make it simple. If I'm going to a corporate, which I've done several times recently and I'm still doing a lot of, I've actually produced a 1.5-page document explaining what the charity does. Before I joined, I said to some of the staff members, I need to know more about this. I was getting booklets, and I read them because I was joining the charity. You go to a corporate, or you meet somebody in the street, or you meet somebody at an event, they're not going to, most of them, read a document like that. So think about simply how you explain what the organization does. Then it gets on to the next stage where they say, actually, that's kind of interesting. Let's have a longer chat about this. And then you start getting involved. And the other thing, as you don't have to be pushy. That's the wrong word, but you do, if you're really enthusiastic, which you all are about the organisation, we all are. Just get that message across. I remember many years ago getting an opportunity, with the Red Cross, for some money from Harrods, and I was given a 4-minute meeting with Dodi Fayed's father, the guy who sadly died when Princess Diana died. And the father ran Harrods. I got a 4-minute meeting. So I arrived there naturally 45 minutes early to make sure I was there and everything. Went in, and at the end of 4 minutes, because I'd come across and simply explained what we were doing, he said to his PA, cancel the next meeting. I want to talk to Geoffrey Dennis a bit longer. And then at the end of it, he said, okay, you're talking about, this was actually in former Yugoslavia we were talking about when during the war there. And he said, okay, I'm going to support one of your mobile clinics out there, which did healthcare and mental health assistance. And that was cost so much. And I said, I was rather hoping you were going to give us 3. And he went, all right, 2. I mean, that's the kind of conversation gently you need to have with people.
Absolutely. And I'm seeing a kind of connective follow-up question here from Lynn that I'm happy to pick up on myself as well. In terms of talking to who, there are lots and lots of people you can start connecting with. First and foremost, when I was a 70/30 ambassador and not a Wave staff member, I found huge impact in talking to friends, family, people on my same university course, colleagues, etc. Being able to talk to people in my life who already trusted me and trusted my judgment, and letting them know why I was passionate about this. And often they were passionate about very similar things. You know, there's a reason that you become close with people. And that was definitely a starting point. And, you know, we were able to kind of push towards the change we wanted to see together. But you can also reach out to people in your community that have some decision-making power. That might be heads in schools. It might be networking with, you know, police, finding out who's involved in the prison system. It might be talking to probation. It might be seeing what mental health services are there, what health services are there in the area, you know, starting to get to know your local community, and even smaller ways. I was always surprised. I would always remember I went as part of my psychology degree to a mental health first aid training that they were doing, suicide prevention training, that was kind of free and open to the public. And there happened to be, I think, 3 hairdressers there, because they were saying, people come and they talk to us about all of the trauma they have been through, and we are not equipped to deal with this, and we don't know what to do. And I think that really opened my eyes to the fact that everyone in the community is coming into contact with this, and everyone in the community is likely to be passionate about it in a different way. So don't be hesitant to talk to people at the supermarket about it, people at restaurants, people, hairdressers, and everyone. I really wouldn't underestimate where you can find passionate people. I don't know, Geoffrey, if you've got any suggestions as well on top of that.
Well, I think the 2 things I would say, I agree totally with what you said. I think there are 2 things. One of them is keep the first message simple, because, you know, if you do meet somebody in the supermarket, or in my case, I'm talking to MPs and talking to people on the train, talking to friends and so on and so on, keep it simple initially. And then if they're interested, which they will be, you take it to the next stage there. The other thing, and lots of people have asked me about this, in, you know, particularly in times when I spent a year in North Korea and Afghanistan during the war, and former Yugoslavia during the war, and more recently in Syria and places like that. I actually firmly and solidly believe that the vast, vast majority of the people in the world are nice people. And I think, you know, if you talk to people and it's somebody you bump into in the supermarket and so on and so on, then the vast majority of people will understand what we're doing and want to help. And I really do believe that. I mean, when I was in North Korea, it was a very difficult country. They just had a cyclone that hit the west coast, and it was about 2 weeks before their harvest was completed and ready to be picked, and it destroyed all the food in the country. So it was a really serious problem, and a lot of people were suffering from mental issues as a result of it as well. I actually came back from North Korea after a year, fairly isolated, thinking, and I still do, that there's some really great people in that country. Really friendly people. Whether you agree with the regime is another question, and I won't go into that in a country like that. And likewise, I mean, I worked quite a lot in Gaza and the West Bank, and there are some awful things that happen, but the vast majority of the people in the world, I firmly believe, are good people. And I think when you start talking to them, you can develop this.
And I not only agree with that, but we know on top of that, with all the research that Wave has done and looked into, the empathy is not something that just is. It is something that is created. It's something that is learned. And so whilst I fully agree that just about everyone is a good person, more than that, we can do a lot to build more empathy and more compassion in the world. So, you know, it very much is something that we shouldn't be afraid to reach out to people for. Now, we've got a few more questions, so I'm going to move on here. We've got a question from Rebecca. So first of all, saying that we've made some huge strides, both nationally and internationally. But she'd like to know, Geoffrey, what you think is the main barrier to getting UK policy on par with countries that have already applied this research and put it into practice.
I think the answer is to explain what we're doing. And the conversations that I've had in government recently, with government officials recently at a senior level, we need to explain what we're doing and then get them passionate about what we're doing, and then say to them, we've got to change the policies in this country. It's sometimes difficult to get in and help a struggling family, because if let's say it's a single parent family or whatever, and say, no, we don't want your help, thank you very much, and so on and so on. In other countries, Norway, we've mentioned 2 or 3 times now, is a good example. The policies are much stronger in allowing people to actually address and getting local authorities to address these issues. I think that's what we've got to do policy-wise. And all the people that I met, literally all of them that I met in Parliament, and I've met a number of MPs and people in the House of Lords, baronesses and so on, and lords, all of those people now fully understand what we're doing and why we're doing it. And then they go away and they come back to me and say, we'd like to make a suggestion. Can you come up with me to meet so-and-so? Because that would be a useful person to talk to at the moment. So I think there's a great deal to do. And I think it's just a question of, I've said it 2 or 3 times, making that first introduction fairly brief, so that people actually get it into their mind what we're trying to do, and then you develop it from there.
I fully agree. And I also think that internationally, there is no one country that has got it all right yet. This is something that is developing. However, there are many countries, including the UK, that have made progress in some areas in different ways. And I think that's one of the reasons we can learn so much from elsewhere. And each country will have its own barriers and its own history and reasons why the policy current doesn't line up to where it needs to be. But that's no reason to assume it can't change. It just means that we need to be pushing in that direction and not giving up. Because things, as we've seen, can change really quite fast when there is that pressure. We saw how things that we would have thought were impossible happened virtually overnight with COVID, and we should really keep that in mind when we're feeling that there are all of these things in the way. Actually, if we push hard enough in the right direction, the UK can be one of the leading countries in what it does from a policy perspective.
Yeah, and I emphasize the partnership bit. You're absolutely right. Talking to other countries, getting, they'll be working on one issue, one particular issue. We're working on a similar issue. Let's work together on this. And I think, likewise in local communities, let's work together and drive this forward.
Sorry, could you repeat the last bit of your answer there, Geoffrey? I don't know if it was just my internet that went a little bit and everyone else heard you, but it cut out for me.
Yeah, sure. So it's just partnerships, just saying that, working with other people, working with other countries and getting some of their experience and we giving some of our experience, that is really powerful to work in partnerships, and likewise in local communities, to work with people that are getting involved in some of the similar issues to ours, but don't have the experience that we've got. Let's work together in those partnerships. That's really powerful. A few years ago, I got on a shortlist with one of the charities that I was CEO of. I got on a shortlist of, I think it was 7 different organizations to get quite a substantial amount of money from one donor. I picked up the phone and spoke to one of the other CEOs of one of the other shortlisted charities. And I said, why don't we work together on this? And her initial reaction was, well, I don't know what my trustees would think about that, because we got a chance of getting several £1 million here. And she phoned me back first thing the next morning and said, yes, I'd like to do it. So we put in a bid. It was a massive project, and it was £10 million was the bid opportunity. So we put in a joint bid. We got it. We got £5 million each. One of my staff said to me, but actually we could have got 10 million, couldn't we? We've settled now for 5. 6 months later, we got another 10 million for both charities. And I think, a lot of people said working in partnership with local communities, with other organizations, working in partnership with MPs and so on is really powerful. And that's what we should do.
100%. So I'm seeing quite a few different questions as well, and we've not got much time. So I will say to anyone whose question we don't get round to, if you want to drop an email to office@wavetrust.org, I'm sure someone in the team will be able to have a look as well. Or if you want to come on one of the future live streams and ask there, don't hesitate to reach out and get in touch. And you can have a look at our website as well to see if the answers are there already in particular. I'm seeing one question that is a really interesting one, but is really quite school specific. And as we've been talking more generally, I might leave that one to a time that we're bringing on one of our colleagues who works more closely on schools, for example. But let me have a look here for a moment. I think I'm quite interested to pull up Claire's question here. Where do you see us in 2 years' time?
I'm hoping about 3 times larger. I really think we've got some fantastic people in a very limited number of staff. I would love to see that expand quite dramatically, and I am trying very hard to get unrestricted funding to actually recruit 1 or 2 more people in as soon as we can on that. I think in the areas around the UK, develop the role of Wave and get more people involved. I'd love to see an increased number of very supportive and active ambassadors. I think that's really important. I think, I'm pulling this out of the air, but I think, let's be 3 times bigger. Let's get those number of staff, those number of local people involved, volunteers, ambassadors. I mean, maybe, we've got some really good ambassadors, but also you can get people that will offer something, maybe from a local corporate. In the past, I've got, doesn't matter who, but let's say Tesco's or whatever, to say, as a local organization, Barclays did this for me, we're in Bradford, let's say, we're going to get our branches in the Bradford area all to support you. There's a lot of things to do, and I would love to see us 3 times larger in 2 years' time. That's my aim.
That's wonderful. I think that links in for me with in terms of what you're saying around fundraising, etc., to this next question. Lynn was asking about basic trainings being available, and I think there's kind of 2 sides to this. There's the training in terms of training for organizations. Wave offers both kind of introductory training around trauma-informed approaches, adverse childhood experiences, etc., but can also do more tailored, more in-depth training. And if there is an organization that is interested, you can find all of that information on our website. We train schools, we train police, we do multi-agency training, we do all kinds of things. And the more people you can find, the more value you can get for kind of the price of the training in whatever way. But if you're talking as ambassadors, this kind of really links back to our fundraising of we are always looking to support the ambassador network as much as possible. We are always looking to grow it. But obviously we have to prioritize amongst our many, many projects in different ways. And so I'm hoping we'll be able to bring you a fresh set of training in the new year at some point for the ambassadors, the same way we did last year, but we haven't yet scheduled any dates or anything. So if you are ambassadors, definitely keep an eye out, and we are discussing that internally in terms of what we can do. We'll see with all of the wonderful fundraising that we're doing, including everything that Geoffrey's mentioned so far, what we're able to bring in the near future, and that will kind of move us forwards. Do you have any thoughts on that before I highlight the next question there?
Well, just quickly, fundraising wise, as a CEO of some major charities, I've done a lot of that, and it's a bit embarrassing to have to say it, but in every organization I've worked in, fundraising has gone up like that, dramatically. So maybe one idea would be at some stage to do a training session which I can run on how to approach organizations and help with the fundraising bit, because I think that would be quite a useful thing to do. And
so I have highlighted the next question because I think it's very much linked to who do we talk to for fundraising, etc. So definitely, I think it would be useful to be able to bring in some of your expertise around fundraising, to link that up with ambassadors in some way going forward.
I mean, the short answer of that is local communities, identify maybe some fairly affluent people that might be individual donors. Talk to corporates. And a lot of the corporates, as I said, Barclays did this a lot, and I said this before, they actually said regionally, or even in one town or city, we've got a Barclays bank. Go and talk to them and say, could you do something to help us drive some money? And if you can get, I mean, the application I sent in yesterday was for quite a sizable sum of money. But if you can get somebody to give £1,000, I mean, in one of my previous charities, in fact, since I joined Wave, I gave a presentation in my local area, a live presentation, which they were interested in hearing about, things like North Korea and so on and so on. But I very quickly led it into Wave. And as a result of that, we've got probably 5 or 6 potential, and some of them already have, donors to the organisation. Now, some of those people are actually in charge of fairly large local corporate organisations. So then the next step is that we get that corporate involved. I think just, talk to people and develop it. But I do think, and I'm happy to do this, and it occurred to me just now, is, at some stage we could have a training session which I can run, explaining how you can get that message across and how also it is. Some of the organizations that I've identified, corporates and trusts and foundations that want to give money, I pick up the telephone and talk to somebody. And you can do it all on email and so on. But if you actually talk to somebody, then some of them will say, no, we don't do that. Some of them will say, yeah, that's a good idea. And one of them, which was a very large bank, invited me as a result of this about a month ago, it was now, to be a part of an internal meeting they had with their foundation. I'll tell you, it's Lloyds Bank. Lloyds Bank have a foundation, and they give quite sizable sums of money to charities every year. They invited me to be part of an internal meeting. All the rest of the people there were local people, or people that work for Lloyds Bank, to be part of their strategic planning meeting. And I spent 2 hours in a meeting with them. Now, you can do things like that, and then they're going to come back and say, actually, we like that organisation. Let's think about that. Just a thought.
No, absolutely. In terms of who to speak to, I can see Lynn asking, I think even if you can't find the right person straight away or don't know where to start, the best way to find out is ask. Walk into the bank, find the first person who works there and say, I'd be curious to see if you do anything to support charities. Do you know who the right person to talk to is? And if they don't know, they'll probably lean over to their colleague and ask them. So don't be afraid to ask, even if you don't know straight away, because they will have maybe a little bit of a different structure between, different corporates and organizations, but don't hesitate to ask.
Well, that's what happened. Just briefly, that's what happened to me with Harrods, because it was a junior member of staff, and it's something on their website saying they thought that what was happening in those days in former Yugoslavia was dreadful, and couldn't they do something to help? And I finished up with a 4-minute, which turned into about an hour's meeting with the chief executive, who gave us a lot of money.
So, Geoffrey, I think we've got time just for some kind of parting comments on our live stream today. What is the one message you want people to remember about Wave?
Make your message simple. Highlight the fantastic work we do. Highlight the scale of the issue, which a lot of people don't know, and then say, can I please come and talk to you about it and explain a bit more? That's what I'm doing at the moment, and it's so far very effective.
Wonderful. Well, thank you for that kind of really useful tip, Geoffrey, which I'm sure a lot of our wonderful supporters will be putting into action soon in different ways. And thank you so much for finding the time to join me today to introduce yourself a little bit more to all of our supporters in a different way. I was very glad that we were able to find the time to do that. To everyone watching today, thank you so much for joining us. I'll again flag up our website in case you're looking for that. We've also started a brand new Facebook page from which we're running this live stream, but you might be watching it in catch up or watching it on YouTube afterwards. If you go on Facebook and search for wavetrust.org as kind of the handle. That is our new Facebook page there as well, and you can stay up to date with all of the great work we're doing. I'm sure we'll be continuing our series of live streams. It might be in the new year. We're just kind of looking at the scheduling now, but we've definitely got some really interesting ones lined up. I think we'll be doing things like intergenerational trauma as well. Did you have a final message there, Geoffrey?
I do. Understand, please, how great Wave is, because we are a fantastic charity. a lot better than lots of other charities, none of which I've worked for, I hasten to add. We are a great organisation and we've got so much to do. It's unbelievable. But we're great. The staff are great. The ambassadors are great. The volunteers that are active are great. We are a fantastic organisation. Please help sell us.
Truly. And I think, is such a big issue here that we are all passionate about solving, and I'm so glad that we have been able to pull together lots of people who not only are passionate but are able to see the solutions and are keen to move things forward to get there. So I think on that note, thank you everyone so much for joining. Thank you again, Geoffrey, for coming along. I'm seeing some thank yous coming up in the comments as well there. But I'll see you all. Geoffrey, I'm sure if you stay on for a second longer with the technology, I can say hi to you all. But have a great rest of the day, everyone.
Thank you.